Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. Once again, April is Occupational Therapy Month, Stress Awareness Month, and Distracted Driving Awareness Month. This week, we're returning to a spotlight on OT Month. In today's episode, I'm taking a dive into how an occupational therapist can be an excellent asset in the community as an independent consultant. Occupational therapy, or OT, is a healthcare profession that focuses on helping people to engage in daily life activities that are meaningful and purposeful to them. OT practitioners work with people of all ages and in various settings, including hospitals, clinics, schools, and community-based settings. One important area where OTs can make a significant difference is in senior care. Most often, this is provided in inpatient settings, such as a hospital, rehab facility, or a nursing home. However, community-based care has continued to improve with increasing numbers of occupational therapists becoming independent senior care consultants. You may be wondering, what is a senior care consultant? A senior care consultant is a professional who provides guidance and support to older adults and their families as they navigate the complexities and the complex landscape of aging-related services and resources. Senior care consultants may also be referred to as geriatric care managers, aging life care professionals, or elder care advisors. Senior care consultants typically have expertise in a range of areas related to aging, including healthcare, housing, financial planning, legal issues, and social support. They can help older adults and their families to identify their needs, navigate the healthcare system, and connect with resources and services that can support their well-being and quality of life. Here are 5 specific tasks that senior care consultants can assist with. 1. Conducting a needs assessment. The consultant will work with the older adult and their family members to assess their needs and identify any areas where additional support may be necessary. 2. Develop a care plan. Based on the needs assessment, the consultant will develop a personalized care plan that outlines the recommended services and resources to support the older adult's well-being. 3. Coordinate care. The consultant may work with healthcare providers, housing providers, and other service providers to coordinate care and ensure that the older adult's needs are being met. 4. Providing education and support. The consultant can provide education and support to the older adult and their family members on topics such as managing chronic conditions, navigating the healthcare system, and accessing community resources. And 5. Advocating for the older adult. The consultant can act as an advocate for the older adult and their family members, ensuring that their rights and wishes are respected and that they receive the best possible care and support. Overall, a senior care consultant can be a valuable resource for older adults and their families as they navigate the challenges of aging. By providing guidance, support, and advocacy, senior care consultants can help older adults to maintain their independence, health, and quality of life. Aging adults and their families and caregivers often face numerous challenges that can impact their quality of life. They may include health issues, mobility limitations, social isolation, and cognitive decline. These challenges can make it difficult for aging adults to participate in activities that they enjoy and find meaningful. This is where an occupational therapist as a senior care consultant can help. Now you may be wondering why or how an occupational therapist may make a good senior care consultant. Well, OTs are a good fit to be a senior care consultant for several reasons, and here are 5. Firstly, holistic perspective. OTs are trained to take a holistic perspective on health and well-being. considering not just the physical aspects of health, but also the emotional, social, and environmental factors that can impact an individual's overall well-being. This perspective is essential when working with older adults, as their needs and challenges are often complex and multifaceted. 2. Expertise in aging-related issues. OTs primarily working with elderly adults have expertise in a range of issues related to aging, including cognitive decline, mobility, and safety issues, and chronic conditions such as arthritis and osteoporosis. This expertise enables OTs to develop personalized care plans that address the unique needs of older adults. 3. Familiarity with healthcare systems and resources. OTs are typically familiar with healthcare systems and resources, which can be complex and challenging to navigate. This familiarity allows them to connect older adults and their families with appropriate services and resources that can support their health and well-being. 4. Advocacy skills. OTs are skilled advocates for their clients, working to ensure that their clients' rights and wishes are respected and that they receive the best possible care and support. This advocacy can be especially important when working with older adults who may be vulnerable to mistreatment or neglect. And 5, interdisciplinary collaboration. OTs are trained to work collaboratively with other healthcare professionals and service providers, which is essential when coordinating care for older adults. By working collaboratively with other professionals, OTs can ensure that older adults receive comprehensive and coordinated care. Overall, the combination of a holistic perspective, expertise in aging-related issues, familiarity with healthcare systems and resources, advocacy skills, and interdisciplinary collaboration makes OTs a good fit to be senior care consultants. By serving as advocates, educators, and coordinators of care, OTs can help older adults and their families navigate the challenges of aging and maintain their health and well-being. See the match? It's a perfect fit. As an OT and as a senior care consultant, we can provide a comprehensive assessment of the individual's needs and develop an individualized plan of care to help them achieve their goals. This plan may include recommendations for modifications to the home environment, assistive technology, and adaptive equipment to help the person perform daily tasks safely and effectively. The OT may also provide education and training to the individual and their family or caregivers on strategies to promote independence and safety. One important role of an OT as a senior care consultant is to support continued participation in meaningful activities. I know I've talked about that a lot on previous episodes, but it's truly really important. Engaging in activities that are enjoyable and fulfilling is essential for maintaining physical and mental well-being. However, aging adults may face barriers to participation, whether it's physical limitations or a lack of social support. An OT can help to identify these barriers and develop strategies to overcome them, such as recommending community programs or connecting the individual with social support resources. Another important aspect of OT as a senior care consultant is fall prevention. Falls are a common and serious problem among aging adults and can lead to injury, hospitalization, and a decline in overall health. An OT can assess the individual's home environment for fall hazards and make recommendations for modifications or adaptations to reduce the risk of falls. They can also provide education on safe mobility and balance training to improve overall safety and reduce the risk of falls. OT as a senior care consultant is also important for preventative care and better long-term outcomes. By addressing health and functional issues early on, an OT can help to prevent or delay the need for more intensive care, such as hospitalization or long-term care placement. An OT can also help to reduce the risk of rehospitalization or further decline in health by promoting independence and providing ongoing support. An important piece of prevention in reducing the risk of rehospitalization for further decline in health involves early detection and early intervention. OTs in the community can play an important role in early detection and intervention, especially for cognitive decline. Here are 5 ways that an OT can help. 1. Conducting cognitive screenings. OTs can administer cognitive screenings to assess an individual's cognitive function and identify any areas of concern. These screenings can be used to detect early signs of cognitive decline, such as memory loss or difficulty with problem solving. 2. Providing education and support. OTs can provide education and support to individuals and their families on strategies to maintain cognitive health, such as engaging in mentally stimulating activities and managing chronic health conditions that can affect cognitive function. 3. Developing personalized interventions. Based on the results of cognitive screenings, OTs can develop personalized interventions to address any areas of concern. These interventions may include cognitive rehab therapy to improve memory and other cognitive skills, as well as strategies to promote independence and safety. 4. Facilitating social connections. Social isolation is a risk factor for cognitive decline, so OTs can work with individuals to facilitate social connections and engagement in meaningful activities that promote cognitive health. And 5. Collaborating with other healthcare providers. OTs can collaborate with other healthcare providers, such as physicians and neuropsychologists, to ensure that individuals receive comprehensive care for their cognitive decline. It's important to note that early detection and intervention for cognitive decline can be beneficial for individuals at any age, not just for older adults. OTs can work with individuals who are experiencing cognitive changes due to conditions such as traumatic brain injury, stroke, or mental health conditions. OTs in the community can also work with individuals who are experiencing cognitive changes due to conditions such as traumatic brain injury, stroke, or mental health conditions. In addition to working with individuals, OTs in the community play a role in community-wide efforts to promote cognitive health. For example, they can provide education and support to community organizations, schools, and other groups on strategies to promote cognitive health and prevent cognitive decline. In addition to supporting the aging adult, an OT as a senior care consultant can also provide valuable support to family members and caregivers. Caregiving can be a challenging and stressful role, and family members may benefit from education and training on strategies to support their loved ones' independence and well-being. An OT can also provide emotional support and resources to help caregivers manage their own stress and well-being. Senior care planning can play a big role in effective long-term care, and occupational therapists in the community can play a significant role in senior care planning. They are skilled in assessing an individual's physical, cognitive, and emotional abilities and limitations, and can develop a personalized plan of care to address their unique needs. Here are 5 ways that an OT can help you with senior care planning. 1. Conducting a comprehensive assessment. An OT can assess the individual's abilities, limitations, and overall health to identify any areas of concern. They can also evaluate the individual's home environment to identify any safety hazards or modifications that may be needed. 2. Developing a personalized plan of care. Based on the assessment, the OT can then develop a personalized plan of care that addresses the individual's needs and goals. This plan may include recommendations for assistive devices, home modifications, and therapy interventions to promote independence and quality of life. 3. Coordinating care. An OT can work with other healthcare providers, such as physicians and nurses, to ensure that the individual is receiving the appropriate care and treatment. They can also coordinate with family members or caregivers to ensure that everyone is on the same page with regard to the individual's care plan. 4. Providing education and training. An OT can provide education and training to the individual and their family and caregivers on strategies to promote independence and safety. This may include training on how to use assistive devices, strategies to manage symptoms of chronic conditions, and fall prevention strategies. And 5, supporting ongoing care. An OT can provide ongoing support to ensure that the individual's care plan is effective and adjust the plan as needed based on changes in the individual's condition or needs. In addition to these specific services, an OT can also provide valuable insights and recommendations for senior care planning. They can offer advice on selecting the most appropriate senior care options based on the individual's needs and preferences. For example, if the individual wants to remain in their home, the OT can make recommendations for modifications to the home environment that can make it safer and more accessible, along with options for in-home care. But if an individual prefers to be in a supportive living environment, an OT can help the senior and the family members learn and understand the various options, such as independent living, assisted living, or a nursing home. The role of an OT as a senior care consultant is crucial for promoting optimal quality of life for aging adults and their families and caregivers. By providing comprehensive assessments, developing individualized care plans, and promoting continued participation in meaningful activities, an OT can help aging adults to maintain their independence, reduce their risk of falls and injury, and improve their overall well-being. Additionally, by providing education and support to family members and caregivers, an OT can help to alleviate some of the stress and burden of caregiving and promote better outcomes for all involved. Occupational therapy as a senior care consultant is an important and valuable resource for aging adults and their families and caregivers. By focusing on promoting independence, preventing falls and injury, and supporting continued participation in meaningful activities, an OT can help aging adults to maintain their quality of life and achieve better long-term outcomes. For those who are considering senior care options, consulting with an OT can provide valuable insight into the unique needs and strengths of the individual, as well as recommendations for care that can help maintain independence and quality of life. It's important to note that the role of an OT as a senior care consultant is not limited to the individual's physical needs. An OT can also provide support for cognitive and mental health challenges, such as dementia or depression. They can provide interventions to support memory and cognitive function, as well as help individuals to maintain their social connections and engage in activities that promote mental well-being. In conclusion, occupational therapy as a senior care consultant is a critical aspect of care for aging adults and their families and caregivers in the community. By providing a holistic approach to care that addresses physical, cognitive, and emotional needs, an OT can help to improve quality of life, promote independence, and prevent or delay the need for more intensive care. For those seeking support for themselves or their loved ones, consulting with an OT can provide valuable insights and recommendations for care that can make a significant difference in overall health and well-being. Tune in next week for another topic on OT and aging. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I will see you next time.